Thank you, Rebecca, and the O'Brien Institute for the invitation to speak here today. I actually don't think I need 30 minutes because a fair bit of what I was going to discuss has already been covered, but I do feel like I should do a seventh inning stretch or something like that to get people to wake up, which I won't. So most of my work does focus on the intersections of race and criminal justice, and I'm actually primarily a policing scholar, but it's kind of difficult to be a race and justice or race and policing scholar without focusing also on drugs. So what I'm going to talk a little bit about today is our history of drug laws in Canada, how they developed, why we're moving towards legalization, and what it is that I think is largely missing from the discussion around cannabis legalization in this country, and some of the things that we need to do to repair the harms done by almost now a century of cannabis prohibition. So the legal framework for cannabis or for drug laws in Canada started in 1908 with the Opium Act. This was a heavily racialized act. It came not long after the completion of the Canadian Pacific Railroad. There were a large number of Chinese immigrants that had been brought over to build the railroad, and once that railroad was complete, they were seen as competition for white laborers, specifically on the West Coast, and so we saw this as a large impetus for the creation of the initiation of the Opium Act. As a colleague earlier noted, cannabis wasn't criminalized until 1923. This came as a surprise to some people because there was very little discussion or public debate around cannabis north of the border, but there certainly was south of the border in the United States. And this was heavily racialized too. It was fear of Mexican immigrants coming up from Mexico into the United States, and again, competing with whites in the United States for jobs and as laborers. Cannabis laws have been strengthened over the years. We saw a little bit of perhaps promise for legalization in the late 60s and 70s with the Ledane Commission, which didn't happen. Canada really ramped up its own war on drugs in the 1980s, and we saw even the Harper government introduce some mandatory minimums around some cannabis-related crimes, cultivation, trafficking, and the likes. So Trudeau's risen to power on a promise to legalize pot, and obviously that was successful. And he, after attaining office, directed the Ministers of Health, Justice, and Public Safety to develop a framework, national framework for legalization. And this was based on an acknowledgement that prohibition had failed in a number of different ways, some of which we have discussed already today, one of which being keeping cannabis out of the hands of young people, of course. There's the idea that legalizing cannabis can curtail, certainly not eliminate, but curtail the black market. And I think there's also the fact that there's a lot of money to be potentially made here, right? The government knows that it's missing out on a lot of potential tax revenue. Now, although we've recognized that criminalization has failed, prohibition has failed, one of the things that's not being discussed broadly in the conversations that are taking place is the fact that criminalization, prohibition hasn't affected people equally, and that we need to perhaps repair some of the harms done by prohibition. So this has already been covered. I often start my criminology classes by asking my students to write down on a piece of paper all the crimes that they've committed, and I then read them out to the class. And part of the reason I do that is to normalize crime and criminal behavior. So I could turn that to you guys and say, how many of you guys in the room have used cannabis? Please don't put your hands up, we're being recorded. But just think about that, right? I'm sure many people in this room have used cannabis, maybe today, maybe you're gonna do so tonight, it's Friday night, right? How many of you worry about the potential impacts of that, though, right? How many of you worry that you're going to be stopped by the police, that you're going to get arrested, and that you may get a criminal record? So while we know that, I'll go back there, rates of use are high. I spent a couple of years up until last September in the United States. I just moved back to Toronto in September. And I was walking around, I was like, wow, Toronto, you are high. With all these new dispensaries everywhere, you could always smell weed in Toronto, Yonge Dundas Square, Queen's Park. You walk through, it didn't really matter what time of day, you could find some marijuana. But it's on a whole nother scale now. It's actually kind of fascinating. But we as Canadians do like cannabis. There's no doubt about that. And as has been previously noted, it's 15 to 24-year-olds who use the most pot. One of the things that we don't have access to in this country is readily available data from our criminal justice system that's disaggregated by race. And as you're going to see a little later, I've managed to attain some. South of the border, we know that rates of drug use are relatively similar across racial groups. In fact, it's often whites in the United States that use more, especially hard drugs, things like cocaine and the likes. But when we look at the American prison system, we know that it's heavily racialized. It's blacks and Latinos that are disproportionately stopped, searched, arrested, and incarcerated for drug crimes. We don't have much in the way of available data here looking at racial differences in drug use, period, or amongst youth. There are several studies. I'm on a forthcoming paper in which we use data from the Ontario High School Drug Survey, and we note that black, white, and Hispanic youth use at relatively similar rates, with Asian, South Asian, and East Asian youth using at lower rates. But there are some markedly similar rates of use across those two different distinct groups of racial groups. An earlier study demonstrated, again, we see similarly, here you can see rates of youth. These are percentage of Toronto youth, and again, I know I'm in Alberta, and this is an Alberta focus conference. The data simply aren't available, so I'm drawing on what little bit of racially disaggregated data does exist. My educated guess would be, of course, that the Aboriginal population would be much more heavily, or much more prominent in the data. Even difference between Calgary and Edmonton with recent immigrant populations too. But the Aboriginal population would feature heavily in some of the criminalized statistics that I'm going to demonstrate in a minute. But what we see here again is relatively similar rates of use for marijuana amongst black, white, and Hispanic youth. For the harder drugs, again, we see white youth using more or reporting having used more than other racial groups. And certainly when we get to the sale of drugs, white and Hispanic youth reporting the highest rates of use. I'm gonna move on, I'll let you get your picture. I should note, this is actually pretty readily available. Tanner and Wortley 2002, Toronto High School Crime and Victimization Survey is the source for that data. So we have high rates of cannabis use. Our police agencies have, and our justice system has paid quite close attention to the use of drugs and to focusing its efforts on enforcing drug laws. These have decreased over the last decade or so, but still, as we can see, between 2000 and 2015, over 800,000 incidents or cases of cannabis possession were reported by Canadian police agencies. There have been approximately 60,000 convictions for cannabis possession since Trudeau obtained office, so as an MP. Again, 60,000 convictions for something that an individual himself admitted to doing while sitting as an MP and then used as a platform to become Prime Minister. I'll let that sink in for a minute. We know not only are rates of use highest amongst young people, but also rates of arrests for cannabis possession. 18 to 24-year-olds, followed by 12 to 17-year-olds. And we can think about why this is. Older people, although they do use less, also are more likely to own a home. Young people often, and especially marginalized young people, if they live in apartments and things like that, typically smoke out in the street where they're more visible. Young people have higher levels of contact with the police anyway, and so when they're doing something like smoking marijuana, which smells and draws attention to individuals, they increase their likelihoods of being caught. Interestingly, Bill Blair, our drug czar, as he's been called, has acknowledged that it's been marginalized and racialized Canadians that have been disproportionately harmed by prohibition. And so I've noted a few times that cannabis is a gateway drug. I believe that cannabis is a gateway drug. I see a couple of people looking at me like this, but not in the way that we typically think about it. Cannabis has been used by the state as a gateway into the lives of our most marginalized populations. I'll say that again, you can tweet it if you like. Cannabis has been used by the state as a gateway into the lives of our most marginalized populations. So, as I've noted several times, and I write fairly often on this, we don't have racially disaggregated criminal justice data like we see in the United Kingdom and the United States. So, what we know about how different social groups and different racial groups have been affected by prohibition is rather thin. The Commission on Systemic Racism and the Ontario Criminal Justice System, which did a review of systemic racism in the Ontario criminal justice system, did note that whether intended or not, the war on drugs in Ontario at the time, this was late 80s, early 90s, had had a disproportionate effect on Ontario's black population. The Toronto Star series, which is actually the impetus for me getting into this line of work as an undergraduate student, showed that blacks were disproportionately arrested for simple drugs possession, and that they were less likely to be released before trial, so to be held for bail. We know that held in remand. Being held in remand has a number of negative consequences that stretch through an individual's experience with the criminal justice system. And more recent data, yet to be released, but that I can talk about, demonstrates that still, through the last decade, it is primarily black and brown Torontonians who have been arrested for cannabis possession. Interestingly enough, are people in the room familiar with the practice of police carding? Do people read the Star? So essentially, the police and the public have lost kind of touch with each other as the police started using cars more often and radios, and we have community policing to try and bridge this gap. One of the ways in which the police now have to get information from the public, in which they try and engage with the public, is through random stops and searches. And when they do this, they often ask a number of questions, and they fill out what are called contact cards. They take that information and they put it into a database. Because Mrs. Jones is no longer telling the police officer, the Bobby that walked through her neighborhood, where crime's happening in the area, the police have to use these kinds of tactics, and they put this information into a database. This started being used as a performance measure, and so in Toronto, police leaders, police superiors were pressuring their officers to fill out more contact cards so they could get more information. Well, police officers were going to marginalized neighborhoods to do this because they knew they weren't going to get pushback from community members. They're also often plagued with higher levels of crime, so there was some justification for doing so, but there's been little correlation between levels of carding and public safety. But what we've seen is that as the push to card in Toronto increased, so did cannabis arrests for cannabis possession. Interestingly enough, it was Bill Blair, again, who made this push for carding, and so it was Bill Blair who has really served to further criminalize this group of already marginalized people. So we know that this type of policing, this kind of harsh enforcement-focused and unjust policing has a number of adverse consequences. I've noted that it's young people who have the highest levels of police contact, and it is young people who are disproportionately affected by unjust policing. So some of the health and mental health related outcomes include depression, anxiety, and post-traumatic stress disorder. Increased likelihood of experiencing police use of force, of course. As rates of contact go up, so does the potential to be assaulted or seriously injured by the police. It promotes a sense of social alienation, reducing education and employment successes, which of course have a number of other negative consequences, including further participation in crime, period. And of course, more contact with the police equals more opportunity for criminalization. This was hard to put into any other form than it is here, so my apologies for those that can't see. This table shows Aboriginal and Black overrepresentation within provincial correctional institutions across the country. And so while very few people are probably, well, no one was going to be sent to prison for minor cannabis possession, as I've noted, it acts as a gateway. So once an individual gets a record or even gets a warning, they're in the system. They become known to police. So if you think about the individual who maybe has a sizable quantity of cannabis on them but still falls under the possession under or even the possession over, they may get probation. If an individual is put on probation, that period of probation might last for a year, 18 months, 2 years. That means that that individual can now no longer engage in a lot of behaviors that they would be able to otherwise, associating with certain people, consuming alcohol, being out after a certain hour, which then they run the risk of failing to comply with, right? The individuals that I'm talking about typically live in neighborhoods that are heavily policed. The police know, because they patrol the same areas, who's under probation. They have Toronto Police, for example, has a probation unit. And so it acts as a kind of a spiral. The initial arrest for and conviction for, or arrest and charge for a minor cannabis offense ends up spiraling and can spiral into something much more serious. And so what we see across the country is that Black and Aboriginal populations not only disproportionately targeted by the police, but also disproportionately overrepresented in our correctional facilities. Not all of this, of course, is for drug crimes, related to a lot of other crimes, but we do know that drug offenses play a role in these statistics. The same goes for the federal population. This is the rates of inmates in in the federal correctional system from 2000 to 2011. What we know is that Black and Aboriginal federal populations have increased drastically between 75 and 95%, depending on the exact group that you're looking at. So as we move forward, Trudeau's promised to strengthen laws around cannabis. I was going to brush over this, but one of my colleagues last night said that I probably shouldn't. The fact that potentially you get 14 years for supplying a minor with cannabis, we know that these laws are not applied equally. And so one of the things that the United States experience has shown us is that racial disparities persist after legalization. Of course, as has been discussed, we're legalizing a very little kind of part of what goes on with cannabis, and we're strengthening a lot of other laws around the drug, right? So what we see here is the potential for, as was just noted, the potential for further criminalization and for actually the expansion of, or the a growth in perhaps these racial disparities. So I'm promoting kind of a three-pronged strategy to address some of the harms of criminalization. This is largely based on the US experience. The first being pardons. As has been noted, the marker of a criminal record has a number of adverse social consequences: ability to obtain employment, to volunteer, to travel. And this, again, has not been applied equally. And so I'm arguing that pardons should be given to people who have been convicted of offenses that are no longer going to be illegal, and for any administrative charges, so those failure to comply, that have stemmed from an original charge that will no longer be illegal. And I think this is the least that an individual who ran on a platform, or who admitted to smoking pot while representing Canadians, or representing a subset of Canadians, this is the least that an individual that ran for office and that was smoking weed while in office can do to people that don't have the same political, social, or economic clout that protected him from criminalization. We know that concentrated incarceration has a number of effects, and again, that these are felt unequally. So incarceration increases the risk of infection, threat of physical violence, psychological trauma, and the like. So these have a number of adverse health consequences that pardoning individuals so that they don't accumulate this criminal record that can then increase their likelihood of going to prison have. Tax diversion. This was covered a little bit earlier, but I think each level of government should commit to diverting a certain proportion of tax revenues that they generate to repairing some of the harms done. Those tax revenues would be directed at whatever kind of jurisdiction that level of government would be responsible for. Municipalities obviously oversee certain things, provincial governments and federal governments. And so a certain proportion of tax revenues from cannabis should be directed at repairing the harms done. Identifying communities that have been disproportionately affected is not difficult. Individuals, when they go into the system, have to fill out large forms in which they include, if they have one, a last known address. So all you'd have to do is go into the database, run a postal code search, and you'd be able to identify the postal codes that have been most affected, let alone the fact that you'd have the names of the individuals for individual focus programming. So some of the things that could be covered: education, healthcare, social programming, community infrastructure, and jobs and skills training. And then inclusion in the emerging industry. What we're seeing here is individuals becoming extremely wealthy from participating in activities that saw lots of other people go to jail. And in the United States, what we're seeing is that certain racialized groups have been almost systematically excluded from the emerging industry for one reason or another, one being the criminal records that will not allow them to engage in the activity, but the other being things like the need to have capital. And so what is being advocated south of the border, and what I'm advocating here, is for a system to ensure that there is inclusion in the emerging industry. preferential access to licenses for individuals from affected communities or that have themselves been affected by prohibition, a tiered licensing system. If we look at the licensing system now, it's extremely difficult to get a license to produce and to sell cannabis in this country. There could be a tiered licensing system for different activities on the spectrum from growth to sale of not only flower, but of some of the extracts and the likes. Specialized loans to help individuals from disadvantaged communities actually get into the industry. And then the development of mentoring programs. Of course, a lot of what we're talking about here is business. Not everyone has access to individuals who have experience and knowledge in business. So that's the end of my talk. Thank you very much. I hope that you'll take some of that home with you today.